It's not feasible to find a decent place to live on minimum wage in Toronto, especially with the costs every year going up and up.
I currently have a place to live due to the love of my friends and good karma, and when they retire, I'll be on the street. If they hadn't been there for me, I'd be on the street now.
The month coming is not yet here, but my mind is already in the rent.
Toronto's need for housing that people can afford is rapidly growing. Over 160,000 people are on the centralized wait list for social housing. When they apply, they're told they could wait 5 years to up to a decade or even longer. People Power Media spoke with Torontonians who are struggling because rent consumes nearly all of their income.
Many people on the wait list for social housing are like Shelley LaHaye. They struggle to pay for market rent because they work a low-wage job or they're on social assistance.
I was working 6 days a week, 11 and a half hours a day at minimum wage, and it was just covering my rent. Then my doctor prescribed Prozac, and it was about $200 a month. And I phoned the welfare office and asked for a drug card, and they said, no, you have to be on welfare to get the drug card. And so I had to quit my job and go on welfare, and that was how the vicious cycle began.
Housing Connections manages Toronto's centralized social housing waitlist, including Toronto Community Housing.
There's no affordable housing in the city of Toronto for a single person on Ontario Works. It's not possible with that. You know, your total income max you can get out of that is just over $700. It's not going to be affordable without a subsidy. Folks on Ontario Disability Support Program are a little better off, but not really.
To find a place that's within my budget here in Toronto is impossible. If the hydro was included, I could go up to $700, but it would be a hardship any higher than that because I have to buy healthy food and transportation, and I'd like to be able to go out and have a coffee with friends once in a while.
A senior who's pulling in $1,400 a month, what's affordable for them? They'll do without many things to put a roof over their head, but how much can they do without?
Despite working 35 years as a proposal writer and project manager for engineering companies, Stephen Shore had to declare bankruptcy due to a series of events, including being laid off.
When I first phoned my friend, I said, things seem to be collapsing here and I'm not going to have any money. Do you know of anybody with a place to live? And he said, yeah, I have a friend who has a place for $700 a month. And that was okay, but I didn't have $700 a month. At that time, I had nothing.
People come to us on a daily basis with a housing need, and they're thinking that maybe we'll be able to help them today or soon to meet that need. In the majority of the cases, we're not able to do that. So they come looking for rent-geared income housing, and we give them an eligibility number and tell them to keep in touch once a year, and they'll be housed in 5 to 10 years. That's not what they came for. We hear in dealing with our community partners and dealing with other folks who work in housing that there are people with a housing need that don't apply.
I asked the lady there, how could I apply for subsidized housing? And she said to me, oh, it takes 5 to 10 years. And I'm thinking, I'm paying for 5 to 10 years again I have to wait for that. So I ignore it. That's why until now, I'm still here. As you could see, we stay here in a living room, and one of my friends is in the bed, one bedroom.
Victoria is renting out the only bedroom in her apartment to a friend. She's taking care of her niece and nephew because her sister died. The three of them sleep in the living room.
Mostly my niece don't want to sleep here. She wants her own bedroom, so I told her, you have to sacrifice for a bed.
Victoria struggles to make ends meet while working part-time at Pearson International Airport. Like Shelley and Stephen, she can't afford rent in Toronto.
According to the Canadian Mortgage and Housing Corporation, affordable means paying 30% of your income on rent. That way, you'll have enough money for food, transportation, clothes, and other basics. They say an average one-bedroom apartment in Toronto costs $980 a month. So, to be able to afford it, your monthly income should be well over $3,000. By this measure, minimum wage earners like retail clerks and receptionists need to work 80 hours a week to afford their rent. Those we talk to desperately need what's called rent geared to income, the most affordable type of housing accessed through the centralized waitlist. Instead of paying market, so most of their income goes towards rent, people pay 30% of their income. The government makes up the difference.
Those without rent geared to income housing rely on charities like Scott Mission for their basic needs.
People that come to the Scott Mission for help are in need of food because they're not able to meet their own basic needs. A great portion of their income goes to pay the rent. And after the rent is paid, their focus is on food and TTC. It's being able to look for a job, being able to go to a doctor's appointment. The most basic things are things that these people are concerned about. So their whole focus becomes survival oriented. And so you have people that are stressed out.
Their health will deteriorate while they wait for housing. And as the wait times continue, their health continues to deteriorate.
People wait for years for social housing in Toronto. In the meantime, their situations change.
When I applied for the TCHC list, I was able to walk and I could do stairs and such. And as time went on, I became weaker and weaker, and location became more vital. About, I guess it was in December or January, finally I couldn't walk anymore at all. And I haven't seen my backyard since last year. So I'm afraid that now that I need an accessible unit, my wait time is going to increase.
There's not a whole lot of rental housing being built. There's not a whole lot of affordable homes to buy, and there's not a whole lot of subsidized housing being built. So while the demand keeps increasing, the supply is stagnant, which is sort of creating a greater demand than we're prepared to meet. So we do see year over year the size of the wait list increasing. And the folks who are on the wait list, the negative impacts of not having affordable housing take their toll.
It's just hard, to not take it personally. It's not me that they don't want to house, but because I've waited 12 years and I see people who've only waited 8 years and they get housing, and I try not to take it personally. It's hard, but I'm trying.
Stories like Shelley's, Victoria's, and Stephen's are not unique. There's about as many people on the wait list as there are living in Toronto community housing right now. Over 160,000 people. That's about 20,000 more than the entire population of Prince Edward Island. Meanwhile, there's more condos being built in Toronto than anywhere else in North America. But the building of new rent-geared to income housing has all but grinded to a halt since the provincial government told the city it's their responsibility. So, more and more people need a home that they can afford, and the wait list continues to grow until the provincial, municipal, and federal governments make housing a priority. They'll continue to wait.
The size of the city and the population is growing, so the demand is increasing and the supply is stagnant. If that continues, it's going to be difficult to keep the economic engine of Toronto going if workers can't live in the city. So it makes sense to start reinvesting in affordable housing to make the city a better place to live. And if the social reasons of having quality affordable housing aren't the drivers, it should be the economic reasons.
It is Toronto. It's where I grew up. I know this place. They don't let us down.
This is Diane Ruiz for People, Power, Media.